Welcome to Mulready Minutes with Oklahoma Insurance Commissioner Glen Mulready. This is a podcast about insurance for insurance folks, risk managers, and business leaders. We'll dive deep, examine what is and isn't working, talk to leaders in the industry, and keep you informed on what's happening in Oklahoma and around the country.
Hi, this is Glen Mulready, Oklahoma Insurance Commissioner. Thanks for joining us on another Mulready Minute podcast. I'm excited today to have a guest who is a expert in his field, Tim Pehrson. I think we first met about 8 years ago.
Yeah.
You had recently moved from Utah. I know immediately I was impressed with Tim and his perspective on healthcare. And so, we in this podcast try to help folks understand a little more deeply about insurance and those topics. And this is certainly something that does impact insurance. It is not directly insurance, but it certainly has a big impact and also impacts everyone out there. I mean, everyone needs healthcare, and so we're excited to have you on. Thanks for joining us,
Thank
Tim.
you. Appreciate being here with you.
Okay, before we move on, let me do my obligatory reading of your bio here. So we have Tim Pehrson, who is the president and CEO of INTEGRIS Health, Oklahoma's largest health system. Since joining INTEGRIS in 2018, Tim has led significant growth and transformation, focusing on improving patient care, safety, affordability, and caregiver engagement across the organization. Tim's innovative leadership and continuous improvement have helped reduce safety events, improve outcomes, and expand access to healthcare for Oklahomans. He will discuss the challenges facing today's healthcare industry, the future of healthcare in Oklahoma, and what it takes to build a stronger, more sustainable system for patients and providers alike. So, Tim, give us a little background. We've got the quick bio there, but give us a little bit of history, maybe prior to 2018, and then how you got here.
Yeah, well, I've worked for 2 health plans in my life, so I've been on the insurance side, and I've worked for 3 health systems that have had health plans. And in these roles in healthcare leadership, you tend to move around the country and be involved in different organizations. So I've had the opportunity to kind of see it from both sides.
Yeah.
And what I learned really early in my career is when you take the payer and the provider, the health systems, you put them together and you really put your minds to thinking about how you can improve patient care, focus on quality first, you end up actually reducing the total cost of care for the community, and you get the best outcomes for the patient, which is really a winning solution. So I had that experience, came here 8 years ago, have loved Oklahoma. It's been a great experience for me and my family, and raised 3 of our 6 children here, and now they're all off and doing their own things. And lo and behold, I had a couple of my older kids who never grew up here moving here, and now I've got grandkids
nice.
here. So it's this is home, and we're delighted to be here and really lean into the community and make it better.
Good. So you're a transplant like me. I came from Boston about 30 years ago, but certainly a Oklahoman by choice is what I like to say.
Yes, exactly.
Well, you came from Utah, and I know before we just started shooting, I mentioned to you just the interesting contrast of health status, right?
Yeah.
Oklahoma is, as we know, and we're not proud of it, is always at the bottom end of that. Talk about those differences a little bit of delivering health care with those disparities.
Yeah, I think Oklahomans are generally more unhealthy than others. It really has to do with a lot of factors that are not related to the health care they receive. So I think it does create some interesting complications when you want to think about it, because when you want to think about improving people's health, often it's because we've made policy decisions over a long period of time that have resulted in unhealthy lifestyles. So, for example, we don't really have sidewalks often here. We don't facilitate healthy living. We don't. We score poorly on reading scores, and that actually helps because you need to be an informed consumer when you go in to get to be healthcare. We've traditionally not expanded Medicaid, and so people don't have access to care. When I first got here, we were the second highest uninsured state, and when there's the stats show when people don't have access to care, they they tend to not do as well.
Yeah, their status
I
drops.
think I worked for Intermountain Healthcare in Salt Lake City, Utah, before I came here for 18 years. And I think one of the things that we were very proactive in doing, they owned a health plan as well, besides being a delivery system, and we really leaned into the health of the community, and really strove to find policies that would create long-term solutions, which is interesting because it's a very conservative state, just like Oklahoma. But I think there was decisions that were made along the way that helped them. Now, there is clearly an element of lifestyle choices that people make in Utah. The predominant faith abstains from tobacco and alcohol and some of the things that might get us unhealthy.
Might slightly impact that.
But overall, people in Utah still like ice cream just like they do here. So, it's more about life choices and policy choices that I think shape the health of a community. And by the way, we've made some really forward-leaning improvements in the state from a policy perspective. And what you learn is that health is a long-term game, right? It's like reading. You can't say, hey, I've got a 22-year-old guy or gal who wants to be an HVAC tech, and I've got lots of demand in our vocational tech schools, but they can't read. You can't go back to third grade now and read. It's the same kind of thing with health. Like, you got to start today, and it's going to impact 7, 10, 15 years down the road.
Yeah,
and I think that's really kind of the key there.
Yeah, great point. Hey, let me take a half a step back, though, and back to INTEGRIS a little bit, because you guys have done a lot within your system. So give us some numbers, an idea of the footprint of INTEGRIS across Oklahoma.
Yeah, INTEGRIS Health is there are a lot of health systems in the state, but INTEGRIS Health is the largest. We have a very strong presence in the metro Oklahoma City area, and in the rural parts of the state, we're in basically the top of Oklahoma, from Woodward to Grove, and have several facilities there. We have 20 hospitals with surgical centers, imaging centers, over 1,000 employed physicians, 14,000 employees that are caregivers that take care of Oklahomans. And believe it or not, we're the fourth largest employer, private employer in the state.
Wow.
So we do play a very important role in the community, not only as a healthcare provider, but as an employer as well.
That's a lot on your plate.
Yeah, but it's fun. It's great. And it's honestly, I love being out amongst our caregivers. They're so amazing. I actually do. I used to go out and work with the employees, and I ended up deciding to video it and share it with other people. So I do this little piece called Not So Undercover Boss. And it's honestly one of my favorite things to do is to go out and work, cleaning bathrooms or registering a patient or working at the bedside. And you just see what amazing people work for our organization. They really care about Oklahomans and making sure that they get the best care possible. It's fun to be with them.
Yeah, that's really great, adding that care into healthcare.
Yeah.
Hey, so talking about trying to balance quality care and affordability. Now, you touched on that earlier, but I'd love to expound on that a bit. When you look globally, the U.S. spends substantially more than other countries. I think last I saw, it's 2024 numbers, but about $15,000 per capita. 18% of our GDP. But when compared to the countries, we're really not getting better outcomes. What do we do about that? What's the big picture?
Yeah, I think it sort of depends on what type of outcomes you're looking at. So if you're taking high-end trauma care, cancer care, transplants, we outperform the rest of the world because we've invested a lot in those areas, and we've underinvested in basic primary care, getting out and seeing your doctor, making sure that people have access
to what you were touching on earlier,
to coverage, right? I mean, and so we tend to. Most industrialized countries actually have a basic system that gives their citizens access to a primary care provider, who can consult with them and take care of them. And in America, we've just not valued that as much. That's changed over the years. There's been more expansion of coverage, but I will tell you that those basic primary care visits on a regular basis actually help prolong life, maybe more than some of the end of life care. And I think if we were to spend more time investing in that front end side of things, that we would see, this similar types of results as other countries.
Yeah, I can't cite those numbers now, but I know I've seen that multiple times of the amount of money we spend at that early part of life and at the very end of life. But if we could spend a little more proactively in the middle part there,
yes,
I think might be substantially more helpful. Talk about your workforce. I mean, I know I read and hear a lot about, gosh, we just don't have enough nurses. And I've just mentioned it earlier, I've got a daughter-in-law in PA school. And what are your challenges to delivering healthcare from a workforce standpoint?
So clinicians are super important in driving care, whether that's a physician, a rad tech, a med tech, a nurse, an MA. And these are challenging jobs. They're working with people. There's a lot of demands, and so it's something we always have to be thinking about. So we've been working with the state on workforce plans to help train more rad techs, nurses, et cetera, and we're doing a lot better. The pandemic was very difficult for everyone. For whatever reason, it drove some people out because it was so grinding. It drove other people in. But the pipeline of training takes some time, and there was a gap between the needs at the time and what we had as supply. But that's starting to get better, but we can't take that for granted. We have to stay on top of it. I think the moment we stop caring about workforce pipelines is the moment that it tends to bite us. And I think we're seeing that in some specialties now. Radiology, anesthesiology, some of these hospital-based services where there's fewer people going into those specialties. And then as a result, we kind of see that in the pipelines as we try to recruit and retain good physicians, in this case, to help us provide those services.
So as the largest health system in Oklahoma and fourth largest employer, are you looking towards incentive programs to try to draw into that? Anything unique that you guys are doing?
We have some fun and interesting partnerships with some universities to figure out how we can improve pipelines. But we also lean into policy here. OU stepped up in a big way. OU Health, not OU Health, the University of Oklahoma, in helping train and take as many people who wanted to become nurses in as possible. And the legislature provided funding for that. And so we're seeing the benefits of that. That was a few years ago, right during the pandemic, and now we're seeing all those nurses come out, and we're not seeing the same levels of shortages that we had before. But same type of thing in the training. We definitely want to be involved and invested in training programs. We have some training. OSU and OU do the majority of our physician training, and we find that they're pretty good about we're pretty good about retaining those people that come here to train, and we have people rotating through our care sites in those training programs, and we find lots of physicians that decide to stick around and stay with us. We have a family practice residency program, Great Plains, and I think every single one of those residents this year are choosing to stay in Oklahoma. And I think the majority of those are actually going to be at an INTEGRIS Health clinics, primary care clinics. So that's pretty exciting. So I think pipelines of workforce are important to be thinking about.
Yeah. And then this interaction between the healthcare system, and insurance companies. And you mentioned that you've been part of some health plans in the past. It's always a I don't know, should I call it a healthy tension? I think a lot of folks don't quite understand that if everything is green lighted that they want to do what their doctor wants to do for them without some sort of checks and balances, we end up with a totally unaffordable system. We already have a very difficult to afford system, but I wonder if you'd talk about that some, your thoughts on that process. And
I think generally speaking, the patients, consumers, like their doctors and hospitals, and they don't like their insurances because they feel like that there's a barrier to them getting what they need, right? I mean, we've all been in that situation where we think we need something and the insurance makes you run through a bunch of hoops to be able to get the kind of care that you think you need. I think that that's, unfortunately, that is the model that we are swimming towards and continue to be in, and I think it creates a lot of conflicts. You're seeing increasing pressures from consumers to say, hey, we're sick of this. Health systems that are just trying to deliver the right care are spending millions and millions of dollars just chasing denials and not getting paid and having to go to arbitration and sue and all these kinds of things just to get paid. It's craziness. My preference and what I've really advocated for here since I've been here, because I've actually worked in an environment where this is the way that it works, is that you fundamentally have the providers say that we are going to focus on evidence-based best practice care. And that sounds easy to do. It's actually pretty hard to do because the way we train physicians, we don't always give them the most current information to be able to make decisions. We haven't provided IT systems that help them make the right decisions. There's lots of disaggregation of care, so it creates potentially bad decisions. But when you really start bringing evidence-based best practice approaches to care, what you find is the total cost of care for the community actually becomes the lowest, and the outcomes for the patients become the best. And so you don't need to have someone in the middle saying, don't do this, because you've got physicians that are focused on doing the right things at the right place for the patient when they need it. And I've seen that because, even though I live in what's called a fee-for-service world in Oklahoma, because that's largely where the insurers here have chosen to play, we've committed to this model of care by putting sites of care where people need them, lower cost settings. We've also created care protocols to help drive best practices. And I was just actually looking at claims data for the people who come to INTEGRIS Health. And INTEGRIS Health is, in aggregate, 15 to 35% lower than the next closest competitor in providing the lowest total cost of care and the highest quality. So it's pretty impressive when organizations get focused on that. You don't need all these pre-authorization tactics that the health plans are using because what we're doing is we're actually driving the lowest total cost of care through our best practice approach. And I think that's where we really need to pivot as an industry. I think the health plans need to do a better job of facilitating that. They've actually they've drugged their feet a lot, quite frankly, in this market, all of them. And they've drug it in other markets that I've been in too. And until health systems like INTEGRIS Health step up and say, this is the direction that we have to go, is when we start seeing movement in that direction. Yeah. And that's really unfortunate. I understand why they drag their feet. It's complex, and there's a lot of actuarial math that goes along in forecasting where you're going to be and so forth. So health systems sometimes aren't as sophisticated to understand the kinds of risks that they're getting into. But if you really lean into that fundamental principle of quality first, evidence-based care always, you find that you don't need some of these brakes that are put on to try and control the cost. Right. And the health plans that's what they're trying to do. I'm not faulting them. That's what they're trying to do. But I think that they're doing it the hard way.
Yeah. Yeah, and our role in that as the insurance department is helping consumers understand their rights in that. I just can't tell you the number of times in my, we're coming up, I guess, on 8 years of someone being upset about something being denied, but not understanding that they have the right to appeal that, an internal appeal with that health plan, and then there's an external appeal with a, unrelated, unbiased third party expert, a provider in that field. And so that's kind of our role then on our consumer assistance side. So there's that. That's another episode of Mulready Minute podcast. I'm Oklahoma Insurance Commissioner Glen Mulready, and we will see you next time.
If you found this episode informative, please subscribe and share with your colleagues. Visit oid.ok.gov/podcast. Let us know what topics you would like to hear about. Until next time, take care from the Oklahoma Insurance Department.